Hey guys.
Hey, welcome back YouTube. Hi.
It's Tiff and Steph.
We're here again to give you some more tips on mental health. Today we'll be talking about PTSD, post-traumatic stress disorder. We are nurse practitioners. We are mental health nurse practitioners, primary care and addiction. Yes, and we have some very good tips. And we'd like to thank everybody for subscribing, liking, viewing, sharing. Thank you all. Please continue to do that.
Yes, and commenting.
And comment.
Oh, we love your comments.
We love your comments. We answer each and every one of them.
Yes,
if
we
you have questions,
girl.
we do.
Oh my God.
We're so excited. This is so exciting for us, and we really hope that we're helping everyone and you're getting something from these videos.
Yes.
So we're going to start off with PTSD, and Tiff is going to start.
So yes, as Stephanie said, PTSD is the acronym for post-traumatic stress disorder, and currently in the United States, about 7 to 8% of the population suffers with PTSD. Very common. So if you're out there struggling with PTSD, know that number one, you're not alone, and that there is help for you. So we're going to break this up into like a two-part, part one and part two. This video will be just kind of understanding PTSD, and then we're going to follow up with the treatment of PTSD. So of course we want to start out with just kind of defining it. It's pretty easy to diagnose. According to DSM-5, to diagnose PTSD, you need to have a trauma. For one, there's some type of trauma that happened in the past. You also need to have flashbacks. Flashbacks tend to be like a vision of the trauma, where you have like a vision of it, and then you typically will have these reoccurring memories of the trauma. You also a lot of times will have nightmares of the trauma. There will usually be severe emotional distress regarding the trauma. People will tend to avoid situations that will trigger any kind of emotional stress around the trauma. They'll avoid, parties or going out or just being around people a lot of times. Sometimes you'll even find that people will have self-destructive behavior. They'll be drinking too much or doing drugs just to kind of suppress some of the feelings around the trauma. A lot of times they'll have difficulty sleeping due to the nightmares. People will have nightmares about the trauma as well, so there'll definitely be sleep issues. And guys, with sleep issues comes difficulty concentrating, and then with difficulty concentrating, we got irritability. It's a domino effect, guys. You know how that goes. Yes. And then people tend to feel very guilty. They feel ashamed about feeling the way they do, because they know that a lot of times it wasn't their fault, but they feel this way and they don't really know how to get out of it. And so that's pretty much how Steph and I diagnose PTSD. And so one of the first things we try to do when patients come in to see us with PTSD is what, Steph? What's the first thing we try not to do?
Judge them.
Don't do it.
We don't judge anyone. You don't want to do that. It just makes them feel worse. So you don't want to do that. And if you have someone who may be going through that, and it's hard for them to talk about it. So if you don't be judgmental, it helps a lot. So, and that's why a lot of our patients really enjoy actually talking to us, even though it's a traumatic experience. We're not judgmental. We don't judge them. Your pain is not my pain. Your pain is not someone else's pain. So that's the first thing. If you have somebody, somebody, don't judge them.
Yes, because they can feel it.
They definitely can.
They can tell when you're judging them.
They can.
Just like you can tell when somebody's judging you.
Correct.
You can tell. And so, like Steph said, just don't do it. Try to be, non-judgmental. Another thing that is helpful when you're around somebody that is suffering with PTSD is have empathy.
Yes.
Have empathy. Just be understanding. You don't have to really understand everything that they're going through, but just know that they're hurting. And even though you may not understand all of the details of their trauma, just know that they may have some pain, they may have some guilt, they may have some shame, and they just need a listening ear sometimes.
Yes.
And you don't always have to agree, because what I find is that people feel like, well, it's a lot easier to have empathy when you agree with somebody versus when you don't agree. You may feel that, their trauma wasn't really that bad.
Mm-hmm.
They really shouldn't be, getting all uptight because they don't want to go to a wedding. Why don't you want to go to the wedding? You should just go.
Mm-hmm.
Well, they don't want to go because maybe there's a trigger there.
Mm-hmm.
And you feel that, that shouldn't be that significant of it.
Correct.
You know what I'm saying?
Correct.
You know what I'm
Correct.
trying to say. You guys.
Absolutely. Y'all hear with this, right? And a lot of that, when she said guilt, it's survivor's guilt. Maybe someone was killed. A good friend of them, they died, and they have survivor's guilt. Why did I survive?
That's a good one.
Why am I still here?
Mm-hmm. Mm-hmm.
And survivor's guilt is a big one.
Mm-hmm. There's a lot of shame.
It's a lot of shame,
Mm-hmm.
a lot of, why am I still here? They didn't make it. Why? That's a lot. That's a lot to deal with.
And it's painful.
It's very painful.
And they struggle with that.
They struggle with it.
And so just have some empathy around that.
Mhm.
That can help your loved one a lot.
Mhm.
And those things, being non-judgmental and having empathy is a great way to support someone who is suffering with PTSD.
Yes. So we have types of PTSD and different type of people that have PTSD.
Yes.
First of all, our veterans. Thank you for your service. Shout out to the veterans.
Yes.
Thank you so much for your service. We
Yes.
so appreciate you.
Yes, we do.
Thank you.
But they suffer.
They suffer. That number one.
Mm-hmm.
Come back, deal with all that,
Mm-hmm.
make it back to us, and they suffer
Mm-hmm. With nightmares.
with nightmares, night terrors,
Ooh, flashbacks.
flashbacks, sirens. I had one patient tell me the smell of gas,
Smells.
smells, triggers.
Yeah.
That goes a lot with the veterans, but then you have our lay people here who have, been raped, some kind of trauma,
Domestic violence.
car accident. Yes, domestic violence. Men on women and women on men. The women on men is becoming more frequent now than ever in the past.
Yeah, I'm seeing a lot of that. It's a
Yes.
lot. Yeah, a lot of verbal abuse. It's still
Verbal.
abuse.
It's
guys.
still abuse.
And that cuts deep. I've had people come to me and tell me, what somebody said to them years ago, when they were little kids, and what somebody said to them, a week ago. And that it can still cause PTSD. It can cause nightmares. It can cause flashbacks. It can cause panic attacks. All of those things can cause you to have PTSD. Another group of people who tend to be overlooked are people who have been in prison.
Absolutely.
The jail system.
They have PTSD out of this world.
Oh, they up there with the veterans.
They're up there with the veterans. Their trauma
Ooh.
and the things they deal with, being locked up, it's almost inhumane. It is inhumane.
Y'all know.
It's inhumane.
We know that y'all know.
It's just unreal.
Y'all know.
You made a mistake, something happened or you didn't. And you're in here and everything is pretty much taken away from you. And if they can even get out and live a normal life, that is good. That's why we're here to help people who are in jail, coming out of jail. It's just everyone, because say a mom and a son. A mom has a son in jail. She can have PTSD from her son being in jail. That can cause PTSD. That is hard to deal with, very painful. It's a lot. Okay?
Can we have a moment of silence?
A moment of silence for that.
the women out there with your son in jail. Moment of silence.
Moment of silence.
Okay.
Yeah.
We're gonna
Roll with that.
We're gonna move on.
Yes.
Okay, because that's the silence. I've had so many women come see me. Their sons have been in jail for years. We're not gonna go on too deep with that. You guys get the gist, but we know that you exist out there, and I hope that your son gets out soon. How about that?
How about that?
Okay, another group that goes unnoticed. Major group. Y'all ready? Heroin addiction, opioid addiction. Ooh, the stories.
They have trauma.
They up there with the jail, up there with the veterans.
They have trauma. They have that.
Up there with domestic violence,
Up there.
human traffickers. Woo!
Up high.
They up high. I've heard some absolutely ridiculous stories of trauma.
Horrifying.
Mm-hmm. They've watched people die and then went to jail.
And
Can you
then went to
imagine?
jail.
Can you imagine that? Watch your best friend die,
And then you going to jail
and then you go to jail, and then you get trauma in jail.
because you was there.
Mm-hmm. I have been in sessions, guys, where I have just sat and cried. I didn't have nothing
Literally.
to say. I just sat there.
Wow. It's like, well, we're going to help you with that. Yes, that is so difficult. It's difficult to hear, but they're good because they don't tell these things.
Mm-mm.
They finally have someone they can talk to and they go, okay, let me tell you, because we dig. Why is that? Why did you feel, what were you doing up to that point when you felt like that? Or, or they're just in their sleep, waking up, screaming. Or seeing things that are not there, or hearing things that are not there. PTS is rough, very rough.
Yes, it is. And I don't want to leave the fathers out. We know that there are great fathers out there that have sons in jail.
Yes.
And daughters in jail.
Yes.
We're not
Yes.
leaving any genders out here. We
None.
know. I have a lot of mothers. I have more mothers come to see me about their sons. But I know that there's fathers out there with sons in
Yes.
jails. We're not leaving y'all out.
No, we understand. And we're here to help. We're going to help.
Another group of people who suffer from PTSD are those who have been in fires. They up there with them too. Put them up there. Woo, put them up there with the veterans and human traffickers. Or be in a fire. Lose somebody in a fire.
Lose someone in a fire. Yes.
That's a rough one.
That's a very rough one.
And then who else we got?
I have some patients who have been came home and found suicide, homicide type, walked in the house and seen, found people dead in their home. They suffer the murder, suicide, suicides by themselves. I have parents that walked in and found their, child dead.
That's why you don't want to judge.
You don't judge people.
Empathy, always.
And it's different ways that people with PTSD will try to hide or get rid of the pain. And that, as we said, addiction, opioid addiction, alcohol addiction, whatever kind of addiction it is.
Absolutely. Car accidents. Another group of people. You'd be surprised, people in car accidents, they can also have PTSD. So just know that PTSD can come from a vast amount of different types of people and situations. So just keep that in mind. So we wanted to just kind of throw out, it's not just veterans, it's not just domestic violence. I think those are like the common
things.
But I think we overlook jail and addiction and car accidents, fires, yeah.
Dog bites,
yeah, dog bites.
Dog bites.
Dog bites too, yeah. and we're probably missing somebody. So, but those are the big ones that we
Yes.
tend to see in our practice.
Some triggers. Triggers may be
Let's define what a trigger is.
trigger.
So let me define trigger and
Trigger.
then you.
I'll do the triggers.
Okay, so a trigger is something that will cause you to either have a flashback, a panic attack, or a nightmare, or high anxiety.
Yes.
Something that will cause you to have a panic attack, a nightmare, high anxiety, or a flashback.
Yes.
So Stephanie is going to give us some examples of some triggers.
Triggers. Sirens.
Sirens for sure.
Smells.
Smells.
Barbecue grill going.
Yeah, I had a patient. Yeah, barbecue grill.
Certain streets.
Mm-hmm.
Certain buildings.
Mhm.
Certain seasons.
Mm-hmm. Christmas season.
The shower.
The shower. Yes, for people who may have had domestic violence in the shower. The shower is a trigger. I have a patient where the shower is a trigger for her. And we're going to do in treatment what she does to treat the shower. That's coming up in the treatment. I'm going to
Yes.
show you. I got a little trick.
We're going to do a second part.
Mm-hmm.
So, PTSD,
Mhm.
depending on the severity,
Mm-hmm.
mild, you can manage. Most of the times you can manage it yourself. Moderate to severe, you're going to need some help from a provider.
Mm-hmm.
And we are going to talk about the things that can help you in our next video.
Yes, and lastly, real quick before we go, another trigger. In addition to sirens and smells and buildings and seasons and streets and certain areas. Let me add one more. Girl. People. Human beings.
Yes.
Sometimes people are triggers. I've had patients, they'll be like, "Ooh, Tiff, my uncle."
Tell my sin, can't stand it. Won't make you know.
So sometimes it's people, and they may not want you to know that their uncle is a trigger, but they'll avoid the uncle. See, that's a lot of times they will avoid.
They will avoid.
That's why you don't judge.
because it brings back that flashback.
Don't judge.
Don't judge.
No judging.
Have empathy.
Don't judge. Seek a provider. If your PTSD is moderate to severe, you're going to need some help.
Mm-hmm.
Sometimes it's just, we'll tell you what it is in the next video.
Yes. Remember, like,
Yes.
share,
Please.
comment, please subscribe, and
Yes.
continue to watch us.
Thank
Thank
you
you.
so much. We love
Bye.
you.